Hello, everyone. This is Cam Tilson with the Pennsylvania Healthcare Benefit Solutions Program, and welcome to our podcast, Community Pharmacy Behind the Counter. In this podcast, we're going to be conducting an interview with Dr. Sophia Herbert and Dr. Elizabeth Almes of the Hub at the University of Pittsburgh Campus Pharmacy. So, let's get started.
Hi, my name's Elsa Fura. I'm one of the interns with the PA Healthcare Benefit Solutions Program. We're first year student pharmacists at the University of Pittsburgh, and we're currently working on a project to highlight how community pharmacists are integral to the overall health of the community and how they can be accessible for the population. So we wanted to interview Dr. Herbert. She's a community pharmacist, and she's going to talk a little bit about her roles and her experience.
I'm Sophia Herbert. I'm a pharmacist, as Elsa said, and I do work in our community pharmacy setting here on campus at the University of Pittsburgh main campus here. But I'm also faculty in the School of Pharmacy, so I work in both the education and the practice side. The full title of where we are right now is called the Pitt Vaccination and Health Connection Hub, and it's attached to our university pharmacy on campus. So it's kind of a novel community pharmacy space.
So you mentioned that this was a novel community pharmacy space. Can you speak a little bit more about the facility itself and the function that it has?
Sure. So we are based on Pitt's main campus. We started out of initially the COVID-19 vaccination efforts in 2021. And then this became a permanent space that next year where we have continued to provide vaccination services, not only to Pitt faculty, staff, and students, but also we are open to the general public, just as the traditional pharmacy is that we're connected to, University Pharmacy. At the same time, we are also an interprofessional education space for all our health science students that we have here at Pitt.
That's awesome. Based on your role at the hub and maybe experience at other community pharmacies, how would you describe the role of the pharmacist and kind of the workflow of the day-to-day life in the community pharmacy setting?
Yeah, so every community pharmacy is a little bit unique, but generally, most outpatient community pharmacies are offering dispensing services of medications. So if you get a prescription from your doctor or another provider, you can take it to a community pharmacy to get that prescription filled. But beyond that, they are access points in the community for so much more. I think of them as a public health destination in communities because they're embedded in communities and can provide things like vaccinations, education on urgent public health needs, and other services that are suited to the specific community that they're in. So many people may be surprised at what their community pharmacy offers above and beyond just their prescriptions that they get.
Definitely, there are so many opportunities for community pharmacists to be integral in public health, and I think that's something that we definitely want to highlight here. So, bringing it back a little bit to prescription dispensing, can you kind of walk us through the workflow of what happens from when the prescription is called out by a prescriber to the patient picking it up?
Sure. Yeah. So there is a lot that happens behind the scenes that the general public doesn't normally see. So I'm glad you asked. When we receive a prescription at the pharmacy, usually we're getting it either from a paper prescription that someone drops off, or more commonly now, electronic prescriptions, or sometimes they're even still faxed over to us. At that point, we make sure that we have the information we need about the patient. We may already have a profile for them if they've got medications with us before, but if they're a new patient, then we need to collect things like what are their allergies, their demographic information to make sure that we've got the right medication for the right person. And then through the dispensing process, we do generally bill to insurance for the medication. Different insurances work differently, so that might mean that someone will have a copay for a medication, or other people it might be no charge, or some things are even still cash based that a patient might get as a prescription too. So we figure out the financial piece of things while we're also looking at, what is the medication, what is the dose, what conditions does the person have. We're looking at their whole picture while we're dispensing the medication to make sure that it's, like I said, the right person, the right medication, that it's indicated for them, it's going to be safe. So while we're doing the insurance piece of things and trying to figure out from a cost standpoint what it's going to mean for this patient to get this prescription, we're also looking at the clinical side of things to make sure that the prescription is going to be appropriate for that person.
So there are a lot of moving parts that are important that to navigate.
Yes, absolutely. Amongst our staff that we work with as well, who are helping with the actual filling process, the data entry into the computer for the prescription, and then generally it's the pharmacist that is doing that final verification to make sure everything is just right before we pass it off to the patient.
Thank you for that elaborate summary. So we're going to move on to vaccines and payment next. So now I'm here with Dr. Almes. She's another community pharmacist here at the Hub, and she's going to talk a little bit about her role here at the Hub.
Yes, so I'm Dr. Liz Almes. I've been in community pharmacy as a pharmacist for over 10 years. My background is primarily in community pharmacy in like a chain setting. And then I did a couple years at an outpatient pharmacy for a large hospital. And then I've been a clinical manager and pharmacist here at the Hub for a little over 2 years.
So I know the Hub is primarily vaccine. So what kind of vaccines do you primarily offer?
So we do a lot of COVID and flu, so our seasonal vaccines. And then we do pretty much every routine vaccine for adults, including HPV, Tdap, varicella, measles, mumps, and rubella. So we can do any vaccine for patients 8 and older. And then we also do travel vaccines as well. We do a lot of travel vaccines. We have relationships with the Allegheny County Health Department, as well as the UPMC travel clinic. We give all travel vaccines, including oral cholera that we do through University Pharmacy it's an oral live vaccine, as well as Japanese encephalitis, rabies. So we actually do more vaccines than the health department, which is why they'll refer patients to us. We get patients from CMU for travel vaccines. So we do a lot of travel vaccines here. It's kind of unique.
So that's very unique, especially more than the health department.
Yes.
Your appointment settings, are they primarily walk-ins? Like the travel, is there any consultation that you guys do? How does that typically look like?
Sure. So we can, I'll start with like kind of non-travel vaccines. So in my head, I put them in buckets. So there's our COVID and flu patients. I'd say it's about 50-50 walk-ins versus pre-scheduled appointments. Especially in that fall time, a lot of times we'll put our sign out. People see us and they're like, oh, I need my COVID and flu vaccine. They'll just walk in. For like the other vaccines, so like HPV, Tdap, varicella, MMR, anything like that. I'd say it's mostly scheduled appointments, so we kind of know who's going to be coming in. We still do get walk-ins though. And then for our travel vaccines, those are typically pre-scheduled. We'll either get prescriptions from a physician at the health department, prescriptions from a physician over at CMU or the UPMC travel clinic. Because our travel prescriptions, our travel vaccines, because they're a little more complicated than just a routine vaccine, we do require a prescription unless we do a travel health consultation, which is a 45-minute to an hour conversation that we have with the patient. It's very individualized. We go through all their vaccine records with them. We go through their specific destination. We come up with a plan for them, including vaccines and prophylactic medications.
And then once they have that appointment, if they don't have a prescription, they can then get their...
Yes, we have a collaborative agreement and a memorandum of understanding with our medical directors. So they basically say that as long as that patient is indicated and it's appropriate, we can basically work them a prescription for their vaccine.
So another role pharmacists take on with collaboration with healthcare.
Yes, we also have standing orders for malaria prophylaxis medication and travelers diarrhea prophylactic medications. So if any patient's like complicated, immunocompromised, transplant patient, sometimes we have to take that a level further and have a conversation with our medical director. But it's very collaborative. It's shared clinical decision making. But usually, patients will come in for their travel consultation. I figure out what they need and they can get their vaccines in the same day. So
yeah, it's definitely a very unique way of going about it. Definitely haven't heard that before. So for the method of payment, can you tell me a little bit about how your patients normally come and pay for their services? Sure. Through insurance, through cash? How do you typically see that on a day-to-day basis?
Sure. So for our vaccines, we do bill insurance. We bill just like a pharmacy does. We're working under University Pharmacy's NPI. We're basically an extension of University Pharmacy. So we bill prescription coverage for most vaccines. We also have contracts to bill for certain medical coverage. So we have for example, a contract with UPMC Medical that we can bill because most of the vaccines for UPMC are covered on the medical side. So that's a side note, depending on the insurance. Sometimes it's covered under the prescription side, sometimes it's covered under the medical side. But usually we can bill their prescription coverage as long as we're contracted and it's covered, they can just get their vaccine. And a lot of vaccines don't have a copay. As far as our travel health consultation, that is an $85 fee. That is not a coverable service through insurance yet. So we just charge patients an $85 cash fee that they pay with a credit card.
Are there any resources you provide to people who maybe don't have full coverage? Do you develop like your Medicare Advantage plan, stuff like that?
So we can bill Medicare, most Medicare plans here. Yeah. So if we have a patient who has Medicare Part D, a lot of times our vaccines are covered on that. If not, we do have contracts to bill Medicare Part B. For as far as someone who maybe is underinsured or uninsured, we do always try to make that connection for them to get their vaccine either for free or very cheaply elsewhere. Right now, at this moment, we don't have funding to give any vaccines for free. A patient also does have the option to pay cash for any vaccine that we offer. But we typically try to connect them elsewhere if they are uninsured, if they're a cash paying patient, but they do have the opportunity to pay cash as well.
A lot of options, a lot of avenues that pharmacists can work with patients to ensure that they're getting at least some coverage, if not all coverage.
Yes, we want patients to get their vaccines, but I also want to make sure that we're being mindful of the underinsured and uninsured and what their different options are as well.
So now that we're in the midst of cold and flu season, what is something that the hub is doing to continuously increase vaccinations rates?
So we put out on like the university website and different bulletins and saying like, hey, it's you still should get your COVID and flu shot. We put out a sign on a sidewalk, which literally like people will see that sign and be like, oh, I should get my COVID and flu shot. That actually happens a lot. We also have like a TV monitor that's always that we can put different slides on and things that says like, hey, still need your COVID and flu vaccines. So. Word of mouth too. We work with because we're working on campus. We're working with a lot of students and a lot of healthcare professionals and staff and faculty on campus and stuff. Just like talking to people and being like, yeah, flu cases are still like pretty high. Like it's a bad year. Like you still should get your flu shot if you haven't. And then like talking to their friends and family and stuff. I think is really helpful as well.
Definitely, especially because this is a pretty rough flu season so far.
Yes, it's the worst one since the 2017-2018 year. Yeah. I think we're officially in the severe category. So, yeah.
Vaccination is especially important.
Yeah, it's still very important. There's some misconception that this flu shot isn't effective, and it still is. Unfortunately, we're just not all the flu cases out there are being covered under the vaccine, but you still should get your flu shot. So,
thank you again, Dr. Almes, for talking to us today. We hope that you guys have learned a lot, and we can hope that the hub continues to thrive.
Yes, thank you so much.
Thank you.
Well, this wraps up our podcast. Thank you so much for taking the time to join us. I hope you found it interesting and informative. And I hope you'll access more of our healthcare podcasts. You can find a link to them on our website at phbsp.org. Additionally, I would like to extend a special thanks to Mr. William McKendry, Dr. Sophia Herbert, Dr. Elizabeth Almes, and the PHBSP interns from the University of Pittsburgh School of Pharmacy. Also, please feel free to reach out to us if you have any questions or concerns about healthcare issues. You can reach us by calling 412-266-8322 or by contacting us at phbsp.org on our Contact Us page. So until next time, please stay safe and stay healthy, and we'll see you at the next one.